So one of the most interesting studies in endodontics was done many years ago, and it was a study done. They had a group of patients that all needed root canal treatment on a lower molar, and they had to have cold sensitivity, spontaneous pain. So they really made sure that this group of patients had a really, really painful tooth. There was about 100 and some patients, and what they did is they did some standard numbing, which, your lip gets numb, your tongue's numb. They come in and they say, "Hey, do you feel numb?" Patient says, "Yes, feel numb." So then they went and tested cold to the tooth in question. And the amazing thing about these studies that were done, only about 56% of people were completely numb on the tooth that needed the root canal treatment. That's not very good odds. That's 1 out of 2 is going to have a painful procedure. So they were wanting to figure out, how do we increase this success to make sure that when we do root canal treatment that patients are comfortable. And intraosseous anesthesia, big term, but what it basically means is after getting the standard numbing, we then do a little procedure which allows us to get anesthetic comfortably, kind of bathe all around the bone inside the jaw. And so what that does, that number from 56% being completely numb actually jumped up to about 98%. So you can tell there that 98 out of 100 patients were completely numb for the procedure, and that's a very predictable result. And as an endodontist, that's the number that we strive for. And so before we ever begin a treatment, we always check to see, hey, is this comfortable? Do you feel anything? And that really sets people at ease when they know we're not trying to speed through the procedure or cut corners or anything like that. We want that patient to get up out of the chair and say, "Wow, you're done. That was amazing. Thanks so much." That's what our goal is for every patient.